Hey, everybody. Welcome to the Black Men with Purpose podcast. For those of you joining us for the first time, it's a pleasure to have you with us. This is a safe space where we share our thoughts on a multitude of topics in hopes of helping Black males, young and not so young, overcome obstacles and challenges that can be hindrances to happiness, productivity, and success. We believe that through our experiences, successes, and failures, we can have some conversations that might help other Black males in their respective journeys through this thing we call life. On today's episode, our topic is going to be healthcare in Black America or the Black community. And I know we don't typically do it like this. I know I don't usually just call people out, but if Brother Rod doesn't mind kicking us off, and the reason I'm asking him to do that is because, one, I know that this is something that's near and dear to him, specifically in the elderly community. And even though the elderly community isn't necessarily the main focus, I still know um, how you feel about this specific topic. And I think your thoughts around it will be a great jump off for the rest of us to kind of to flow into it. So if you don't mind, if you do, we'll have Byron or somebody do it. But no, not seriously. If you don't mind,
Yeah, no, not at all, brother. I appreciate that, man. Good seeing you guys.
for
Uh,
sure.
so healthcare is one of the topics near and dear to my heart for a lot of different reasons. But to try to make sure that I go in some type of succinct order, not all over the place. Uh, I think there are a lot of layers to uh, to healthcare disparities within the Black community, in particular, uh, and so we can trace it to many different things, and I will just name some of those things. So first of all, uh, has to do with accessibility, right? Having access to quality health care. Uh, I remember back when I was a kid, uh, having to, catch two, three different buses to get to a doctor's appointment, and then you take the challenges of what the Black community looked like then. There were, as we all talk about in other topics, single parent households, mothers working sometimes two to three jobs, while also having to take care of a sick child if the child got sick. And what that meant was they didn't get paid for that day. Uh, so I think accessibility is one of the things that places us at a disadvantage. The second being affordability. Uh, you know, Unfortunately, I think a lot of times the people that are, you know, making the decisions and coming up with the policies are not people that have to worry about where they're going to get health care from, where their, you know, family or their kids are going to get health care at. They already know that. They got great health care. And, uh, and so they don't have to worry about those things. But again, you take a community of people less fortunate, uh, they do, right? And then you look at the cost of prescription medicine,
Yeah.
and then you talk about the things that impact disproportionately the African American community, something like diabetes, and the cost of insulin and how people can't afford it. And so those things just create this vicious cycle that we never seem to be able to get out from under. Uh, and then as you know, the elderly, baby boom generation, they're all getting older now. And so this, as much as it impacts the African American community, it just impacts older people, period, regardless of race. And that's the accessibility and affordability of uh, assisted living care or special needs care for elderly. It's one, it's not enough of it now that the population has gotten older, and two, it's just not affordable. You have, maybe 100 patients waiting to get into a facility that has two beds available to those that are eligible for and on Medicare. you know and I think that a lot of times, because we spend so much time chasing what has been sold to us as the American dream, we don't really look at all the pits that lie in front of us as we go down that path, and to prepare for that. How many people have ever sat through and talked about long-term care insurance? Like, what's that? You know, we pay our car insurance, we pay our homeowners insurance if we're fortunate enough to have a home, but long-term care insurance, you know, a lot of people don't even know it exists, alone, what it can help offset once you get older. Uh, so just to start, those are things that really, to me, kind of sets us up for what some of the challenges are, and then so from where we sit, knowing that. So once you become educated and you know that, uh, what do you do about it? And I think that's part of kind of why we wanted to have this conversation, to talk about not only what some of those challenges are, but what people, especially in the African American community, could start considering planning for, to kind of offset the inevitable. Right? We talk about being blessed and living long lives, only to find out that once you get to a certain age, that blessed long life that you have places you in a place of poverty, uh, and a life that you really were not prepared for. So we want folks to live out their lives with dignity and grace, but it comes back to lack of health care, lack of affordability and accessibility,
Yeah,
uh, lack of good food, right? You eat this balanced meal and you won't have as many healthcare issues, maybe, as opposed to eating a lot of processed foods that, and I think from an educational perspective, that's probably where we can make the largest impact. Uh, but then even after that, you got to say, okay, where can I go if I live in this community? Where can I go and get fresh fruits and vegetables?
absolutely.
So the challenges are plenty, but as far as what we can do, I think education is probably the biggest piece of that. And I'll pass it off to another brother and come back later. But those are my initial thoughts.
Now I
Yeah,
was going to jump in there because man, that was just an incredible way to encapsulate a lot of those issues, especially, obviously we talk about healthcare in the Black community, and anything that affects these communities is part of a microcosm of a larger community. And so when we say we want better healthcare for Black people, the um, the impact of that is that it'll improve and increase healthcare for everybody else. But I mean, you know what? I'm gonna let somebody else go because somebody's at the door.
you know. I'll jump in, and Rod, you again. That was the reason why I even asked you to do it, because I knew you would hit on all the points, really all the jump off points. And I was thinking a lot about, before you got going. I was thinking a lot about the fact that, to me, poverty and food desert, right, go hand in hand. And you kind of mentioned something about, having access to, healthy foods and things like that. And I think that is certainly part of the problem. But I think, racial inequality, in all spaces, right, will always kind of present these hardships for those of us who are in the diaspora. And without kind of both an understanding as well as a desire to change that narrative, those unequal spaces will continue to kind of underserve Black and Brown people. And obviously and unfortunately, that includes the healthcare industry. Um, I think that obviously, I'm not going to say eliminate, but I think we can mitigate some health risk and reduce some of the disparities and inequities by addressing some of the social factors that lead to healthcare challenges. And again, you talked about this as well. Things like unemployment, underemployment, living in poverty, cost prohibitive effects of trying to see a doctor, smoking, inactive lifestyle, et cetera, et cetera, et cetera. Right? All these factors affect Blacks at an alarmingly high rate, right? And at younger ages than whites as well. And I think for us to kind of mitigate some of those things, um, you know, it shouldn't be incumbent upon us, even though it always seems to be. Anytime, if we expect anything to improve in a Black community, right, it always has to start with us. And that's just the way that it is. If we don't demand it, then it's never going to happen. And I think so. Some of the things that we probably need to do is continuing to raise public um, and provider awareness regarding racial and ethnic disparities in care. And the reason that I say that is because you would think that that's something that's simple, right? That everybody should be aware of the fact that it's in the news all the time. But yeah, we know that we're well aware, but not everybody is unfortunately aware of it. And obviously, some people don't care. But then there are those who I saw a survey um not long back, man, I don't know, at some point last year, I saw a survey that said something like 7 in 10 um white people think that there is complete equality in healthcare, right? But those same 7 in 10 probably think there's complete equality, period, across the board in all spaces, which to me is baffling. Like I was, wow, just completely nonplussed by that. Like, are you kidding me? 7 in 10 think that, you know, and so kind of continuing to raise the awareness, but also things like expanding health insurance coverage, right? Which that's going to go back to voting, right? And making sure that we get the right people in there and all those sorts of things, people who are going to attempt to do things like that. Improving the capacity and the number of providers that are in underserved um, and underprivileged communities, right? So, and not only that, but also kind of increasing the knowledge base on the causes as well as um, interventions to reduce those disparities. So I think those are some of the things that might be able to help mitigate to a degree. Obviously, I don't think that's enough, but it's something. But another thing, and I don't want to harp too much on this one because Lord knows I will go down a rabbit hole on this one because I get riled up in thinking about it. But healthcare, public and private, right, operate in a free market. That's ridiculous. That shouldn't happen, right? Healthcare should not be a commodity. If you just think about New York City as an example, public facilities kind of serve the bulk of poor and working class citizens, which we know what that means, right? Black and brown mostly. And they are ridiculously underfunded, right? These community hospitals operate with budget deficits that are as deep as $3 billion with a B. How do you function? How do you get a provider to care when the facility that they're operating in has a deficit of $3 billion? Whereas you get these private hospitals, which serve upper middle class, wealthy, right? They operate with a profit. And that is just, again, healthcare should not be a commodity. And the fact that it operates in a free market is a large part of why we see a lot of what we see. And so that's kind of my take for now, and I'll let somebody else jump in.
That's a good rabbit hole.
Mm-hmm.
Yeah,
Yeah.
it's a deep rabbit hole, that's for sure.
Yeah. I did that's what I did my study on was how the Affordable Health Care Act impacts nonprofit hospitals. I did my study between 3 hospitals. So I did a hospital where the median income was $130,000. And then my other two hospitals, 66% of their clientele were Medicaid, Medicare, right? And so those hospitals, like you said, Kevin, they don't have the funding to get the best doctors. They don't get the funding to add on a cancer wing. They don't get those funding. Whereas the hospital that's 135,000 medium income, if 90% of your patients are paid insurers, right? So that means, guess what? I can bill your hospital, I can bill your insurance, and I'm probably going to get 90% of my bill paid. Your insurance may push back and say, well, we're not going to pay the $18 for that one aspirin. We'll give you $12, right? Whereas Medicaid, that Medicaid is going to be like, it's $6. That's all we're paying you. And you know what I'm saying? And so now, of course, these hospitals, guess what they can do? They can get better staff, because guess what? Now I can go get the best trauma surgeons. I can go get the best urologists, because guess what? Because we can afford to pay for it. To Rod's point about just healthcare as a whole, one day I was sitting in my office and everybody, they were doing their what they call it in November, when they have to do their sign up for their new insurance open enrollment. So I had a lady in my office. She just willed out. She said, dang, I got to pay $400 per pay period for health insurance. And so that was $400 per pay period. And on top of that, when people you're paying this premium every month, and then if you still go to the hospital, you still have a 80-20 rule. Well, your insurer is going to pay 20%, but you pay 80%, but you still got to pay 20% of what's left of the bill. And so I really learned this when I had my stroke. The 20 days that I was in rehab and the 6 days in the hospital came to $92,000.
Wow.
$92,000. So let's say a family had good insurance. If they still had to come up with 20% of $92,000, that goes back to what Rod is saying. It's like, hey, yeah, we got good jobs, we got good insurance, but now all of a sudden we got to come up with what,
$9,200.
That was not factored into our budget.
18.
You know what I'm saying? And yeah, we got $5,000 saved up, but what are we going to do with the rest? So it's crazy how just in general, healthcare, just the cost of healthcare is so ridiculous in this country. And so many people are making so much money. I heard that Pfizer was going to say, as soon as the government stops paying for the COVID vaccine, they're going to start charging people $120 to $130 just to get one shot. And I'm like, come on. So now the people in the poor communities that were getting the shot for free, where they go? I'm going to get COVID. I'm going to take the COVID shot, or we're going to buy groceries. I'm going to take the COVID shot, or we're going to pay the light bill so we're not sitting in the dark. It shouldn't be that people have to make that choice for healthcare, not in the richest country in the world. I mean, if Canada can do it, I don't understand why we can't. You know what I'm saying? So that's just, I'm kind of with y'all, with Rod on this thing about healthcare. It just baffles me how we are the richest country in the world, and you got these CEOs, and don't even talk about CEO salaries that CEOs of healthcare system. I mean, the hospital that I worked at, MedStar, had 9 hospitals. This guy was working at the flagship. The CEO was making $1.5 million and getting a $350,000 bonus every year. Now you're laying off, and they always had around the holidays, they're laying off the people that's making $20 an hour. The single mom that's got 2 kids that works as a clerk and keeping the records, making $45,000 a year. You're laying these people off, but you get to keep your $2 million salary and your $250,000 bonus. It's just crazy. I mean, at some point, how much money is enough money? So
it's ridiculous.
I'm done with that part. So
just tag on what you said, man. I mean, you're talking about the salaries and the bonuses, It's not just that. It's how about the stock buybacks? They're doing that instead of reinvesting in the community. And the only thing they're worrying about is their bottom line. Like you said, like they're worried about their pockets being lined with money. They're not worrying about the smaller person, like you said, the lower to middle class. They're not worrying about them. They're only worrying about the upper echelon of the country. And I go back to Kevin's point about the poll. The 7 out of 10 believe that healthcare is equal. I'd like to know where in the hell did they conduct that doggone poll at? Because we know that's not even close.
Who responds to polls anyway?
but it's like that with politics. I mean, they go find the pool that they want to find, and they'll ask the questions, and of course, to me, the answers are going to be slanted. So again, when Kevin said that, I mean, we all shook our heads like, yeah, I'm like, where in the hell did they conduct that poll at? It had to be in a rich neighborhood, somebody that's clearly disillusioned, saying that everything healthcare is equal. Like, yeah, well, there's no racism in America either, really? Or Obama?
Well, if you think about it, the poll was strictly for white people. So you don't have to go to specific neighborhoods. It was for white people. It doesn't matter where you go. 7 in 10 white people, period, felt that way. So, and it's not surprising, honestly, really, when you think about it. It was baffling at first, but then when I thought about it, I'm like, well, that actually makes sense, because that's probably about the same percentage that thinks that, that think that racism doesn't exist anyway.
Well, then they still had to have gone to a rich white folks, because there's no way in hell you can
poor
convince
white
me
people
that
not
white
at
people
all.
believe that.
Poor
That's
white people think the same way.
That's crazy.
Yeah.
Again, I'm not doubting y'all, but which is crazy, because they will cut their nose off in spite of the face. But that's another time. There's another time for another story like that. But one thing I wanted to tackle as well. I mean, because we're talking about the physical health and Rod's point to lack of accessibility, affordability, the lack of affordable prescription medicine. There's also the lack of for mental health, because I get sick and tired of hearing or seeing the stigma that goes along with mental health. And I just remember my grandmother back in the day saying, that boy ain't right in the head. Well, there might be something that's going on there where he needs some help mentally, but again, that negative stigma, we don't want our child labeled, as having a problem. But then they basically over medicated everything with, Ritalin. ADHD all of a sudden came out. Well, you know what? I'm sorry. I not that I don't believe that exists, but I think they're over medicating. They're just saying, okay, well, this child is being extra talkative, so we're going to medicate him so he stays quiet. But I think that's one of the things that we really got to get past too, where I think mental health really, really needs to be addressed. And that's something I feel strongly about, and I don't want to start rambling. So I'm going to, John had to stop because somebody was at his door. So
I'm gonna edit that out, so you had to say it again. I'm gonna edit it out. So it's gonna be smooth when they see. They're not gonna even notice. But no, I appreciate that volley. That's something. So like when we talk about those issues, man, we look at the system issues, the structural issues. Gary Chambers dropped a carousel on Instagram, and I love Gary Chambers. He ran for Senate in Louisiana. Man, he's an incredible guy. And he talked about one of the things that we've gotten fooled on is now that we think, oh, well, we can pull out of the political game and just worry about getting our money. And he said that's how we get ourselves a situation where we got money, but we don't have no power. We don't have no say-so when it comes to systems like insurance and healthcare and, the way that they are provided. So when we look at this, I mean, it's bleak, but I think it's important for us to talk about it. I know that we always want to be solution-based, but yeah, it's a bleak situation. I read an article the other day that said that it said impoverished white women get better health care and have better survival rates than wealthy Black women.
I saw that too. I saw that same article.
That's crazy. Wealthy Black women get inferior care to impoverished white women. And, the way Rod opened it up for us, is taking advantage of disadvantaged communities, which first black and brown, second elderly, third the special needs. And so they just take advantage of all these communities and free market healthcare. That's crazy. Like
Ridiculous.
that is crazy because free market basically it says you make more money, we're going to charge you less to get quality health care. You make less money, we're going to charge you more and penalize you more, and they're penalizing us being poor. I would really like, there was a conversation we were having offline. I'd really like to get the operational costs of senior care and nursing homes because the ticket of admission for that, me personally, I'm like, yeah, no, I'm definitely, my mom's married, so she got a husband taking care of her right now. But if that changes, I'm taking care of mama, But a lot of people ain't in that position. Like, what does it cost operationally? Because they not paying the people that work there, and they taxing the people that need the service. And then, like Byron said, if that dude is making 1 point something million and getting 350, you could employ 30 people for a year on his salary, but yet you cutting people that are making. So there's a lot of issues there. There's so much. So I think, to tackle it, the first thing is what are the avenues that are available to us? Like Rod said, what was the insurance as you get retirement insurance or longevity insurance? Something like
Long-term care insurance.
long-term care insurance. We got to figure out everything that's out there, but we definitely got to get political power because think about why politicians don't care about our long-term health care because they're vested after 5 years. They're going to get a lifetime pension, and then if you do 20 years, you get once you do 20 years, you get vested at the age of 50 for the rest of your life. So like their health care and their money and all that is going to be taken care of for a lifetime. And so why would they be concerned about us working folks and the issues that we're going to face? So I mean, what are the solutions that are out there? What are some of the tools that we can use? What are the insurance plans that are affordable? What can be done? Where do we need to lobby? It's so much. It's so I could go on and on, thinking about the equity in doctors of color. 70% of all of the doctors in America that are black come from HBCUs. And yet we don't fund HBCUs and their medical centers and all of that. But the majority of our doctors come from there. So this is one of those ones that's big. So it's just a rabbit hole episode,
Yeah, it really is. And Rod, before you jump back in, because I know you want to jump back in, that article, which my wife actually told me about, John, that you mentioned, it's staggering when you think about it. When you think about the fact that the poorest white woman in this country is going to get better maternal health care for her and her child than Rihanna, who is the second richest black woman in the world behind Oprah, right? And I'm not saying that Rihanna should get some special care because she's worth billions of dollars, but how is that possible that the poorest white woman is going to fare better, her and her child, than someone who's worth more than $2 billion? Like that just sounds only in America, right? Anyway,
Yeah, because only in America do the citizens allow the institutions to maintain control over all the important things that impact their lives,
yeah,
right? And we
yeah, yeah,
continue to, exchange time for money. And if you're making more money, then you feel like you're doing better. But at the end of the day, the institutions still control the things that are probably most important to you.
yep.
And so that goes back to the politics of it all and why it's imperative that people be engaged, involved, and hold politicians accountable. Because that's why it's allowed to continue. I always tell people, and I tell my team at work that Selfishness is the root of all evil. People believe it's the love of money. We've always heard that. But when you throw in selfishness and how everyone's always looking out for themselves, and then you throw in this capitalistic society where they reward that, now you know why. Because people will do anything. I know some people that would sell their mother to make a profit if they thought they could do it and get away with it. You know, so so when you have that, to me, the only way that you can really address it is to one, you got to get to the root cause and start breaking that thing up. You know, it's how, not to get too far into politics, but it's how Roe v. Wade was overturned by 5 or 6 individuals,
Yeah.
a law that had been standing for so long.
Over
Those
50 years.
those 5 or 6 individuals, yeah, they just decided on their own that they knew better about how women should govern their bodies and their health care than the women themselves.
Yeah.
That's crazy to me.
Yeah.
But you have those institutions, lifetime appointment. So now I'm going to empower you to do what you want. You cannot be removed. That's too much. I mean, it really is. The politicians, well, they have great health care, so they don't have to worry about it.
Yep.
So yeah, and all I got to do is keep giving my constituents the Heisman, and then every now and again I throw them a bone, right, or some big thing. But when you look at it, though, it healthcare, the affordability of prescription drugs, why anyone can carry a weapon, why military weapons are available to purchase by individuals. When you start looking at it over and over, who gets access to quality food and who doesn't, it almost seems like it's all part of a greater scheme. Not to be a conspiracy theorist, but it becomes, like I said, this cyclical thing where we can never catch up. You can never get the solution.
Yep.
It's always evading you, and they're depending on people to not pay attention to the undercurrent that's driving all this, right? Everyone likes to stay on the surface, because they're not going to spend the time that it takes to actually read, learn, do some research, really understand a process from cradle to grave, to know where the flaws are and where the opportunities might be to make substantive change. People are not going to do that, But I would tell you, I wish I knew in my 20s and 30s what I understand now, right? Because they want young people to be wilding out and changing that next, hot thing on social media or wherever they are, and not paying attention to the things that are really important. The education system.
Right.
How in the world? I hear Bernie Sanders said that that teachers should be paid at least $60,000. That's nothing to do with healthcare, but just to tell you about all the systems that are so broken.
Mm-hmm.
And then you go back to the healthcare and the stress that's driven by all these challenges that you have. That contributes to your bad health. And then when you can't even be seen regularly with a primary care physician to help you navigate that, then you start coming up with other ways to cope, like eating more bad and processed food,
Mm-hmm.
That causes more health disparities and health challenges that you can't deal with. I, yeah, it does kind of seem like a rabbit hole because it's so much. It can
Yeah.
become overwhelming,
Yeah.
which is why I say, what's the one thing that we can do, or that people in general can do or should be doing? And that's why I go back to the, just getting educated on it, and do what you can. Like this whole
Yeah.
idea of, exercise and staying active. If you can't do anything else, you can get up and go walk, you know, do that for you. You should be doing something for you every day anyway, right?
For sure.
Yeah, so do that for you. But I don't think that healthcare in America is going to be fixed because I don't think that the power brokers and the
Yeah.
power institutions in America want it fixed. They really don't.
Absolutely.
Period.
Yeah.
Point blank,
No.
Ron. To your point, there's no profit in the cure, but there is definitely profit in keeping you sick.
Yeah.
There's definitely profit in that. So you're absolutely right. And I didn't mean to cut you all off,
Yeah.
Caleb. Fire.
Yeah. And B, before, because I know you want to jump in real quick. Rod's point made me think of a good book to throw in there, because he talked about the whole politics and how all of it works. I read a book recently. The book was published in 1849, right, by Henry David Thoreau, called "On the Duty of Civil Disobedience," and that whole book was talking about what happens when the government is allowed to just rule without the people having their say, right? We know that they're supposed to be there representing us. And his whole point to that book, and the book is only something like 50 pages long, so anybody can read it. It's a quick read. But in 1849, he talked about this, and exactly what he talked about. You might as well call the man Nostradamus, because that's exactly what's happening these days. Exactly what he talked about, when politicians are allowed to just rule and not care about what the people want. So, B, I'll let you go ahead and jump in.
You know what Rob was saying about just healthcare. When you look at the fact that when you look at the numbers as far as CEOs in healthcare, when you look at 76% of CEOs are white males. When you look at positions like uh, surgeons, trauma surgeons, 76% of trauma surgeons are white males. And so when you look at the fact, somebody mentioned earlier about HBCUs producing what, 70% of the 1% of doctors that we have. So when you look at that and you see where it goes back again, that those things, healthcare, CEO, doctors, those are positions that are coveted by people that's like, oh no, y'all as a people, black people, y'all can't never achieve that. Y'all can't be doctors. Y'all can't be, directors in healthcare industry. Y'all don't have the skill set to do that. But I think for us, one thing we have to do is start pushing people into those areas. Like we just, even when we started with voting, we're getting people to vote the people in that will think for us, that will help shape our communities. Now, guess what we got to do? We got to prepare ourselves to be in those positions. We got to prepare ourselves to be the judges, to prosecutors, right? To be the sheriff. And guess what? Now we need to start pushing people toward healthcare. We already made a push a couple of years ago in the STEM. We started pushing more, seeing black girls in STEM. We got to start pushing more people of us into the healthcare arena, because
Great
that's the
point,
only
B.
way it's going to change. Because when they start seeing people looking like us as their peers, now we can have that conversation because we're peer to peer. But when they're looking at us, when they see our people coming into the ER, and going back to a rock, when they come into the ER and we use the ER as our primary care physician, and we don't, and so I know the doctors, I've heard them have conversations, oh, this is a repeat, or this somebody who comes in all the time. They just, we're gonna patch him up, they're gonna go back out, and they're gonna come back later with the same thing. So we got to start putting ourselves in these positions where we have to start pushing our people into these arenas where they can make an impact, and it's just like everything they're talking about, all the black coaches in the NFL, every place where there's a position, a prestige in this country, university presidents, outside of HBCUs, you could probably count on two hands the number of university presidents of color outside of HBCUs. You know what I'm saying? So when you same thing with healthcare, when you start looking at the number of CEOs in healthcare industry, on one hand, you can count the number of CEOs of healthcare CEOs of color in healthcare, politicians. You know, even when we look at our current situation with the Senate and Congress right now, the number of people of color are just not there. And so if we just start putting, we just have to start saying, you know what, we want to make a difference. We got to start pushing our young people into what's your dream? Oh, you want to be a doctor? Let's do what we got to do to make you fulfill that dream. If you want to be a politician, what do we need to do to make you fulfill that dream? And again, that goes back to, you know, HBCUs, you know, and I'm done after this, but, you know, Elizabeth Warren made a good point about a year ago. She was like, hey, the number of students that go to Ivy League school that need student aid or students or student loans, 2%. State schools, maybe 50%. But at HBCUs, 80% of our students still need student loans to go to school. You know, and so when you figure the Ivy League schools, you're talking third generation doctors. So yeah, grandma was waiting for you to go to school, so grandma could write the check for you to go to school. It ain't gonna be no problem for you to go to Harvard, you know. Or
It gets deeper than that.
Yeah,
because at Harvard and Harvard, Yale, Princeton, and Brown, Stanford isn't quite there yet. But at those four, the endowments are so large that you can go for free. They used to tell us to tell students, you know, if you were out of state and went, all you'd have to pay were the out of state fees because the endowments are so large, you don't even have to pay tuition if you get accepted.
Exactly.
Right.
Yep.
Yep. This is indeed a rabbit hole, and if y'all are good with wrapping this up, because I know that both Bia and John also have other commitments this evening, but I also wanted to introduce our new segment and give everybody their opportunity to have their 2 or 3 minutes to rant. So, where anybody want to have anything else to wrap up on the healthcare issue? Because Lord knows we can talk about this for hours.
I just want to second what Byron said, man. We need to think big, man. We need to put our kids in position to do all this stuff. We be thinking small. And I remember a couple episodes ago, I was talking about we should start small, but we need to start thinking big, man. Go back to Black Wall Street days, man. Black Wall Street had 2 hospitals and an airport. You know what I mean? So we've done it before. They came out of Reconstruction and Black people showed out.
Thrive, absolutely thrive.
You know, and that's the key. So the blueprint has already been laid out. The example is there, right?
Yeah.
You know, which is why I think that's why they wanted so many, you know, African Americans to feel like they were actually getting a larger slice of the American dream, right? So that way they wouldn't be focused on
we working on daydream,
self-sustaining communities. You know, they had access to good food. They had banks, you know, hospitals, like John said. And not to say that you want to be an isolationist, but you do want to do what you can to make sure that you are able to sustain yourself in a lot of ways, right? Otherwise, you're dependent on a government that, you know, didn't write a constitution for you to really be included in. You know, so I'll get off of that because healthcare is something that will come up again and again and again.
Absolutely.
You know, so as far as the 2-minute rant, I'll just put it first.
Well, let me introduce it real quick, right? Because it's new.
Hang on a second, Kev, before y'all go there.
Wait. We need to let Byron go first because he got to go.
Well, no, I want to introduce it before.
Yeah, introduce it and let Byron go. Yeah,
that's what I'm saying.
Introduce it and let Byron go first.
Okay. All right. So this new segment that we have called the rant, where each of us will take 2 to 3 minutes to kind of get something off our chest, I guess, so to speak. That something that's kind of been on our mind and that we really want to kind of speak to. And each of us will have kind of a different topic. So we're going to take 2 to 3 minutes apiece to do that. And like John said, since B has got to jump off, we'll let him start.
Okay. I was going to rant with Rod point about us not being selfish. Rod mentioned that earlier about healthcare and the reason why we can't go back to those days of Wall Street because we're selfish. You know what I'm saying? They wasn't
And
selfish.
greedy.
They wasn't selfish back then. It was like you need to eat, we all gonna eat. You know what I'm saying? But anyway, 2 minute rant. Uh, Eric Benelamy, the coach has.
Yeah, that's
The
Eric.
enemy.
Hey,
Close
that's
enough,
Eric,
man.
the enemy for the record keepers. Eric, the enemy. We got you. Go ahead.
I just remember him from his days in Colorado. Listen, uh, Jake Tapper mentioned it yesterday on CNN. He was like, I was like, wow, he just called it out. He's like, listen, are you telling me Eric is not a head coach because he's black? And I was like, wow, he just called it out. If I was him, I wouldn't even go interview with anybody for no another OC position. I'm like, if I can't run the show, I'm gonna just stay where I am in Kansas City. You know what I'm saying? But yeah, you got these other two guys that lost in the Super Bowl, but both ended up with head coaching jobs. I don't get it. I don't get it. But yeah, that's my rant. It's just like, we talk about healthcare in the black community. It's just like, dude, no matter how hard we push, we still gonna get some injustices some kind of way. And I'm not saying that we just stop, but we definitely gotta keep pushing. Definitely gotta keep pushing.
For sure.
Good stuff, B. Well, real quick, I wanted to jump in. I want to go back to something Rod said earlier. Rod said that folks will sell their mothers for profit. And Rod, you're absolutely correct. But I know my mom is watching this episode. Mom, you're safe. I would never sell you. So I just wanted to make sure I got that out there real quick. What I wanted to rant about was we have got to start making sure that we are paying attention to our kids and our grandkids for those of us that have them. For changes in their behavior. I'm seeing more and more upticks of, kids are being molested, kids are being sold into or being human trafficked. And a lot of these kids are acting out, and I don't think the parents are really paying attention or the grandparents are paying attention. We have got to pay attention to our kids. We've got to start asking the questions because they may have been threatened with somebody saying, if you tell anybody, I'll kill you, I'll kill your parents, I'll kill your loved ones. We have got to pay attention that if our kids and our grandkids are starting to have different changes in behaviors, attitudes, start asking questions because something else could be going on, and it could be that they are being molested. And I'm sick and tired of seeing our kids constantly fall by the wayside when that's happening because we're either choosing not to listen to them, to believe them, or we're just not paying attention to what the symptoms or the signs that they are showing are. And that's it. That's all I had, brothers.
And Rod, I know you were trying to jump in off that on the rant from the beginning. So
Oh no, you can go ahead. No, I'm good. I'm good. But yeah, I can go. So it's so many things to rant about. Uh, but the one that I really wanted to bring up was the fact that it seems as I look at so many different areas of our lives and things that impact uh, African Americans disproportionately in this country, I often think about what is it that we can do to help ourselves, right? And then that comes back to what do we value and what are we willing to spend our time and resources on? Uh, because I've learned as I've gotten older that you can have but so much money and buy but so big of a house and have so many cars that sit. You can't even drive them all at one time. But those are the things that we value as opposed to finding ways to have better communities. And so I say that to say that for all that we want to talk about the disparities within this country that we have to fight against or have always had to fight against, I think we should spend an equal amount of time looking at the things that we can do different and better to kind of help ourselves and help our brothers and sisters be better versions of themselves. Uh, so I don't want anyone watching this to think that, it's ever about bashing uh, a race of people or a community of people. It's really about what can we do to uplift one another. Because I would tell you that that's kind of the key to what they've been able to do to hold us back. For those that have wanted to hold us back, was kind of let them destroy themselves, right? That's just kind of where the concept of these
Yeah.
ghettos and these communities of people, that are clawing to try and get a fair and equitable opportunity come from. Well, put them in there, they'll destroy it themselves. Yeah, we'll build them a brand new building, but when we go back next year, it's not going to look anything like it did when we left it with them. So, so my challenge to anyone watching would be, try and figure out ways that you can contribute positively and responsibly to the world, the community that you want to see for yourself and others.
Man, so I'll jump in and we'll let Dr. Kev close out because I know he gonna hit us with a hammer. But uh man, Ryan said it earlier, and this is just one of my big things that I think that, he talked about how in our communities we think that we have to trade our time for money. We don't have wealth principles, but beyond not having wealth principles, we don't even have a wealth mindset or a wealth desire. Like, think about, it's a badge of honor to grow up in a difficult neighborhood or some other stuff like that. Like, you know, like, we'll make fun of kids that grew up in a good neighborhood with parents that took care of them, so forth and so on. Like, that's a bad thing. And I think what we need to start doing is normalizing those conversations of affluence. Like, it's okay for us to be multimillionaires and billionaires and own companies and be at the top, and stop thinking, oh, well, my origin story needs to be I got it out the mud. How about we get our families out the mud and we start paying people to navigate the mud for us, so we ain't never got to walk on it no more. So I want to, I really think that as a community, we need to normalize success. We need to normalize affluence. We need to normalize the excellence. We carry it as if, things are supposed to go bad for us. You hear the conversations like when Flint was going on. They said, well, I don't know why Jay-Z didn't just pay the money. Why should Jay-Z have to pay money for Flint when there are officials that were hired to do that job? And the idea that there's a comedian, he said this. He said, man, I would never be a fan of reversing, white supremacy and doing black supremacy. But he said, if I did, the first thing I'd do is I would take the strongest, biggest, and most athletic from their community, and I'd pay them a lot of money to play games. And I was like, what? And he said, then I'd take the most talented of them. I'd pay them a lot of money to sing songs and act in movies. So that and I said, man, listen. And that's our idea. Like, when you look at other communities, they're not looking to their athletes and their entertainers to be the voice of how the community go forward. But for us, Jay-Z need to do it. LeBron need to do it. What's Michael Jordan doing? No. We need to be leaning on our politicians and our thought leaders and our, so normalize though. That's my rant. And I went over 2-3 minutes, so I'm gonna pass it on.
That's a good rant. Now, my rant actually has to do with the fight against racism, and I thought about it because lately I've been seeing, and it's not really just lately, I've just been noticing it more lately, on Twitter, on Instagram, where people will post something, say something about these racist systems and stuff like that. And then inevitably, you always have these racists who will jump in and say something that's just way off base, has nothing to do with anything. Like, what are you talking about? Like, garlic make my feet stink. What does that have to do with anything? and they do it as a distraction, right? And it's reminiscent of a quote by Toni Morrison, and I just pulled it up so that I don't mess it up. But her quote is, the function, the very serious function of racism is distraction. It keeps you from doing your work. It keeps you explaining over and over again your reason for being. Somebody says you have no language and you spend 20 years proving that you do. Somebody says your head isn't shaped properly, so you have scientists working on that. Somebody says you have no art, so you dress that up. Somebody says you have no kingdom, so you dress that up. None of this is necessary. There will always be one more thing. So my whole point to the rant is, don't be distracted, right? Racism is something that is serious that we have to continue fighting. And you will always have those who will intentionally try to distract you with some nonsense. Don't fall for the banana in the tailpipe. Keep fighting against racism. Keep your focus. So that is my rant. And with that, we want to thank each of you for taking the time to join us. And as we wrap up this week's episode, I want to leave you with a quote getting back to the healthcare topic. The quote's by an unknown author, and it goes, "For care to be considered high quality, it must be equitable. Inequitable care is low quality care and must be treated as such." The quote goes on to say, "Improving healthcare requires a holistic approach. Change is needed everywhere, from the bedside to the boardroom, to how payers pay for care, all the way to healthcare policy, all the way to healthcare policy changes. Until those things occur, healthcare disparities will continue, and that's unfortunate. Until next time, peace."